Kourtney Kardashian, they are sitting on Instagram gold mines. The Keeping Up star is so valuable that brand executives are reportedly shelling out 6 figures for a social media endorsement aimed right at you. Khloe and Kourtney can rack up $250,000 for sharing advertising snaps with their 68 million and 58 million followers. And the Queen middle sister Kim paid up to $500,000 for a campaign posted to her 101 million Instagram fans. Remember, it was only last month sources say the beauty mogul made $14 million in just minutes selling her contour kit, a product that was mostly marketed on social media. It seems when it comes to social media, it can feel like one big commercial, but is that good or bad? Board-certified cosmetic and plastic surgeon Dr. Stephen Davis and his patient Debbie Shane here to talk about this issue. Dr. Davis, social media, people scrolling, saving photos, coming to you and saying, I want to look like this.
That's exactly right. Everybody at home, think about this. When was the last time you took a selfie?
Yes.
And the first time you said, it's good enough?
Never.
Never, right?
Or rarely.
So that's what's happening. People are taking photos of themselves, or they see themselves in a photo and they go, oh my God, this is something I really have to work on, be it their lips, their skin, their eyes, something. And nowadays, plastic surgeons can do things to really make that change for them.
And so for you, you probably remember the days when people would come in and say, Dr. Davis, my lips just aren't full. Where now they come in and say, Dr. Davis, I want Kylie Jenner lips.
That's exactly right. And they are driving the younger and younger patient into the office, because when they see Kylie Jenner, it's a 20-year-old, 25-year-old girl coming in who years ago would never really have come in for plastic surgery until they got a little older. Now they know there are these minimally invasive type of procedures, most of them injectables, that they can do right at their lunch break or whenever, and they get it done right away, and they look great in the next photo.
Debbie, talk about some of your experiences.
Well, my experience has been more on the lines of networking.
Okay.
I use social media a lot to network. Facebook, Instagram. I'm a business owner, so that's important for me. Keeping up appearance is important. You have as they say, you have a few minutes to make a first impression.
Absolutely.
That's the same thing on social media also. So that's a big driver for me to
Do you remember a time when maybe you would have been more scared, apprehensive, or afraid to do some of these things, and now you're not?
Well, actually, I've been seeing Dr. Davis since I was 28 years old.
Oh, wow.
So I was always, you know, I've always been taking care of myself, and I always knew it was important. You know, I'm a business person. But I do believe as social media became more prevalent that people are seeing their picture over and over again. They change their profile picture, and it's a big to-do for them to change their profile picture. It's
Dr. Davis,
stressful.
Yeah, speak to this. I know a lot of people say, oh, plastic surgery is a cash business. They'll take your money. You will tell people, no, we can't do this. This is not for you, or you don't need this.
Absolutely. We see patients all the time that ask for things that are a little over the top.
Right.
And I don't want to be the guy that's doing that. So, you know, we try to explain to them there are certain things you want to do to stay within the realms of normality. And unfortunately, they can travel somewhere else and look for somebody that will do what they're asking to be done. But most of the time, honest to God, the #1 reason why people are scared to do this is that they think they're going to look nutty after they get the procedure. So most people really aren't looking to be out of the norm. They just want to look better in all their photos. And sometimes they'll say, you know what, I love Kylie Jenner's lips. Can you do that to mine? And that's what we're really trying to do, is try to give them the aesthetic look that they're going.
They're going for, because you're not going to have Kylie Jenner's lips, but you might have lips that look like Kylie Jenner's lips.
Exactly.
I gotcha. Tell people where they can find you really quickly.
I'm Dr. Stephen Davis, and you can find me at Davis Cosmetic Plastic Surgery.
Over in Jersey.
Over in Jersey. We have an office in Philadelphia, too.
Oh, see, I didn't know that.
That's right.
Okay. All right. Thank you so much, Debbie, for sharing your story.